So hello everyone and welcome to Get Healthy at Work's first webinar in our four-part series. As everyone would be well aware, today's webinar will focus on building a strong mental health culture within your organisation. My name is Stuart Wright and I'm one of the Senior Project Officers on the Get Healthy at Work team, and I'll be facilitating today's webinar. Before we get into the webinar, I would like to acknowledge the traditional owners of the lands in which I'm working today. I'm joining this webinar from Camaragal land, and I would like to pay respects to elders past, present and emerging, and acknowledge that across this webinar we'll be meeting on lots of lands or many different nations. Now I'm very excited to announce that we'll be joined by two great panelists today. On the webinar today, we of course have Jill Green, who is a Senior Project Officer with SafeWork New South Wales and works on the Mentally Healthy Workplaces team. And at the start of this webinar, Jill will be taking us through a presentation on the proactive approaches you can take to creating mentally healthy workplaces in a changed environment. Jill has over 18 years experience in education, communication and project management in both New South Wales and Western Australia. Jill is very passionate about driving behaviour change through education and implementation, and as I'm sure you'll see, that will come out throughout the webinar today. And in addition to working as part of the Mentally Healthy Workplaces team, Jill is also involved in the implementation of New South Wales Government's Mentally Healthy Workplaces Strategy 2018-2022. Hi Jill.
Thanks, Stu, and thanks very much. I'm very excited to be here today. Thanks, Mark, as well, for joining me today. I'm looking forward to speaking with you after the presentation. So I just want to take you through the presentation today. As Stu mentioned, I am the Senior Project Officer with SafeWork New South Wales. We are implementing the Mentally Healthy Workplaces Strategy. A couple of things I wanted to talk to you about today is why mental health is important in the workplace, and then what we're doing about it in terms of supporting New South Wales businesses to create mentally healthy workplaces through our Mentally Healthy Workplaces Strategy, as I mentioned, and then looking at a risk management approach as well. So as SafeWork, we look at the psychosocial hazards and risks on the workplace and what practical solutions and tools we can use to address those. So that's really in a nutshell what I'll be talking about before we move into the questions. So as you can see by this slide, we know that 1 in 6 people of a working age experience mental health at some given time. Sometimes they report 1 in 5. So we know that a workplace can have a really positive impact on someone's well-being or could have a detrimental impact as well. And I guess when we look at the statistics, we know that almost half of all Australians aged between 16 and 85 will experience some form of mental illness at some point in their life. So those statistics are quite sobering, and we know that, as I mentioned before, a workplace can play a vital role given that we spend a third of our life at work. When we talk about health, the continuum represented here looks at both our health in the blue, which is when we're experiencing really bad days, and in the green when we're experiencing really good days. And it's not static. It can change from day to day, year to year, month to month, week on week. So it's likely that at some point, someone in your workplace will experience some sort of mental ill health. And when we consider what that looks like, 45% of the population in Australia will experience some mental ill health at some point. So drilling down into what it looks like in New South Wales currently of the statistics is publication on the Have Your Say website. But I guess it paints the statistics show that 53% increase in claims for 2018 and 19, and over 26,000 workers had needed time off work. So that equates to a 585 million gross incurred cost as well. And so our regulators are taking action, and as I said, through our code of practice that is now available, our draft code of practice, we encourage you to jump on the Have Your Say website. If the code of practice is adopted, it will provide practical guidance for a person conducting a business undertaking to address psychological and psychosocial risks and hazards in the workplace and psychological health. So further to this, as part of our Mentally Healthy Workplaces strategy, we actually undertook a benchmarking survey of 2,000 businesses in New South Wales, and that was in 2017. But what it showed was less than 30% of businesses were taking effective action to proactively manage mental health at work. We have this research on our website if anyone's interested. But one of the things that came out with this research is that there were 4 high-risk industry sectors that were kind of performing badly in this space. And that was information and media, transport, warehouse and the postal sector, professional services and professional scientific and technical services, and manufacturing. So we've been working closely with those industry sectors to improve their mental health in the space and their capability and capacity of those sectors. And we're currently measuring against the baseline that we did. And the results, the interim results are very positive. We, of course, certainly have a long way to go. So we are interested to find out the final findings there. And if you're interested in this, I've got the link to the website. I'll be sharing this PowerPoint presentation after the webinar. So what's in it for my business? We know that mentally healthy workplaces are good for business, but really it is the right thing to do. You have a moral impetus to provide a safe psychological workplace for your employees. But I guess the benefits are really called out here on this slide: increased productivity, reduced turnover, retention of staff, reduction of workers' compensation claims. So those are some of the key benefits. But we did actually commission some research which showed that it supports your bottom line. So for every $1 spent, you can expect to achieve a return on investment of $4. So, you know, when we look at it in terms of good business sense, it certainly applies here. So let's look at the other side of it. As I said, it makes good business sense, but this is also in the workplace health and safety legislation. So creating a physically safe space and a psychologically healthy space is part of the workplace health and safety legislation under Section 19. So there is a legal obligation for employees to do that. And I guess the first critical step is adopting a risk management approach to psychological hazards. And the step process on the slide is underpinned by consultation. So it's very important to be able to consult with your staff. And how do you do that? There's a couple of ways. You could, you know, if you're a small business or a large business, you might take different approaches because it's not a one-fits-all approach. But certainly there's surveys. You could have an individual conversations, you could have group focus groups. There's a number of ways, and certainly there's some great tools that you can use to do this as well, which is the People at Work tool is one of those risk assessment tools that we're working currently with our jurisdictional counterparts, some of our jurisdictional counterparts, to digitise this tool, and that should be available in the coming months. So look out for that. And we've got, you know, the SafeWork guide as well. So that SafeWork guide will support you in looking at your risk management processes here. And then, of course, there's the Queensland Mental Health Toolkit too, which can also support you with some practical solutions. And on our website, Mental Health at Work, we actually have a designated section that talks about some of those risks and some of those actions that you could take. Rightio. So in terms of risk factors, what are those risk factors? So we know high and low job demands, low job control, poor support. Those are all some of those risk factors. Workers can be impacted by one or many, and it's important that organisations really understand what these risk factors are. And as I said in my previous slide, make sure that there's consultation in place to identify the risks and manage those risks appropriately. So what does a mentally healthy workplace look like? I guess we're kind of flipping the slide now to look at some of those key things that we know support a mentally healthy workplace. Good job design, clear job descriptions, promoting mental health and wellbeing, offering mental health training, rewards and recognition, and as we're talking about today, that positive and inclusive culture. So those are some of the key things. The other thing that we look at is that mental health is everybody's responsibility in the workplace, and it should be embedded into everything that you do within your business. And I guess some of the key objectives for our strategy is that reducing the impact of mental ill health and improving health and social outcomes for New South Wales. So these are just some practical steps that you can take. And as I said, I'll be sharing these slides after. So get tangible and visible senior support, analyse your workplace, pick an appropriate strategy, check your results, and then adjust your strategies. So these are some of the things that you can consider, and we've got some dot points underneath in terms of preparing a business case, looking at your data. What is your data showing you? You know, what is in your consultation? What are you seeing? What are the anecdotal things that might be happening in your workplace that you need to take heed of? So about the strategy. So we have an ambitious target that 90,000 businesses take effective action. Our strategy was launched in 2018. We have partners that are working very closely with us, who are the State Insurance Regulatory Authority and Insurance and Care. And as I mentioned before, our key objectives around reducing the impact and taking a preventative approach to mental health in the workplace. This sits under our SafeWork roadmap as well. If you're interested, the full strategy is also linked into this presentation, so feel free to have a look at that later. So what's available on our strategy? This is actually a snapshot of our webpage. So when you go on to our mental health at work .newsouthwales.gov.au, this is what you'll see. We have our mental health capability check. That is an 8-question survey, so you complete that survey and it provides you with a bit of a bespoke report and a baseline of where you sit with some key actions that you can take. And that's just a quick snapshot that you can use to see how you're tracking. And then, of course, I was speaking previously about the free programs. Now, these are great programs. I can speak from experience because I've actually sat in on these programs that Black Dog are delivering. We also have Assure, which I'll talk a little bit about just now, but the Black Dog programs are delivered online. Now, we had to change the way we deliver these because previously they were face-to-face, and then with COVID we were proactive in moving it to an online version. But it doesn't mean to say that the online isn't interactive. We have a clinical psychologist that's in the webinar with you. We have breakout rooms. We have opportunity for role play. And the great thing about this is that you learn those strategies, whether you're a people leader, which is the first one, managing team wellbeing is really focused on people leaders, or whether you're a worker, individual, a sole trader. We've been hearing a lot that small businesses have been impacted, as we know, by COVID, drought, fires, all sorts of things. So they're struggling a bit. And so these workshops provide you with the strategies, how to identify whether you're not feeling okay yourself, but then when others aren't great, and then having that conversation. And then we've got the free workplace health and safety advice program that's with an organisational psychologist, and essentially that helps the business develop an action plan and go through the steps. So I encourage you to jump on our website and have a look a little bit more. These programs, as it says at the top, are available for small and medium businesses up to 200 employees and all not-for-profit organisations in New South Wales. So finally, just want to reflect on COVID. It was interesting because yesterday, I just want to read from my notes here a little bit. Yesterday, I got some updated stats from Sierra. 93 confirmed COVID-19 cases, of which 88 are psychological injuries. So we do know that COVID is creating anxiety, isolation for a lot of people. Some people have embraced it, some people enjoy the working from home and so on and so forth, but some people are really, really struggling. And so what we did was, as you know, SafeWork New South Wales has regular updates around COVID, and that's really a good source of information more broadly. But in terms of mental health and recovery, we have published our page on our Mental Health at Work website that has a number of tools and resources, as well as the Get Healthy at Work program, which you can do a little survey and find out how you're tracking with your own health, and then it refers to some really good referral options. And so we encourage you to jump on there too. We have another consultation out in actual fact, which is live on the Have Your Say, and we're trying to get feedback about how people are feeling during COVID, in particular around their work. So I'd encourage you to jump on there and engage in some of those tools. And visit our website, because we're always updating that with current and most relevant information, and I think that's very vital information for you to look at. One of the key things is our Recovery at Work Toolkit, which has very much a COVID flavour to it now, and the CIRA, who are leading that piece of work, have also recently published their lived experience framework, which is worth a look. Anyway, that's it from me, Stu. I'd like to hand over to you now, because we've got a great case study that I'd like to play, and I'll hand over to you. Thanks, everyone, for listening.
Thanks so much, Jill. That was a fantastic presentation, and it was great to see the ambitious strategy and the ambitious KPIs that you have with your program. And look, lots of great learnings and takeaways for our audience there. So look, let's get into this video, shall we?
Thank you.
In a small business, there's nowhere to hide. Like, you can't hide amongst 100 employees or anything like that. So one of the hardest challenges I think to deal with is probably burning out or overworking. Problems always need to get solved, and there can be a lot of pressure on a lot of people. Throughout this process, I think one of the kind of more global learnings is the idea that you need to factor in mental health as part of your business plan almost, in that if you have a healthy working environment, it actually has strong business outcomes. So prioritizing it and actually addressing it proactively is good, sustainable business policy as well.
I think what really makes a mentally healthy workplace is a culture of people listening to each other and caring about each other. As long as you've got each other's backs, that's all the support you need to do the work that you need to do.
All right, yeah, excellent video there that really does support what you're kind of talking about just before, Jill. All right, well, we're now going to move on to our question and answer section of the webinar. It's probably a good time for me to highlight that you can use the chat function within Zoom to send some questions in. We'll filter through some. We also did collect some questions upon registration, so we'll be going through a few of those registration questions. And this does provide me with a great opportunity to introduce our other panelists for today, Mark Leopold. Mark is the Head of Policy and Strategic Alliances with SuperFriend. Basically, SuperFriend designs and delivers mental health initiatives that enables workplaces to thrive. And so we've actually got Mark joining us from Melbourne today. Mark will be bringing many things to today's webinar, including leadership experiences across a diverse array of companies, which does include his time as Head of Workplace Engagement at Beyond Blue. Mark understands that effective, visible action on mental health and wellbeing improves organisational performance. Mark helps businesses to be more effective by applying evidence-informed principles related to workplace mental health and wellbeing. And Mark works with people to deliver workplaces that promote the benefits of good work, manage risk, and support people in need. Hi, Mark.
Hi, thanks for having me, and thanks, Jill, for your presentation and for all the registrants and everyone that's in on this webinar. I think in a rather unexpected way, we've got around about 300 people in my living room, so welcome.
Well, I'm glad you can cater us all. Thanks, Mark. All right, well, we haven't had a chance to hear from you yet, Mark, so I'm going to start by asking you our first question. Now, this one's going to lay a bit of a platform, but why is mental health and wellbeing important to focus on in a workplace?
Thanks, Stu. Before I just answer that question, can I just acknowledge a couple of things, please? And that is, firstly, that I'm presenting here today on the lands of the Bunurong people of the Kulin Nation, and I want to pay respect to their elders, past, present and emerging. And I'd also like to acknowledge anyone listening in with a lived experience of a mental health condition and indeed may have been impacted by suicide, and just acknowledge the importance of their voice in creating solutions, programs, policies, both at organisational level, government level and wherever else. So that voice of lived experience is really important. So thank you for dialing in. The importance of mental health in a workplace. Well, look, I think fundamentally they are directly related. Jill's presentation was quite clear. There's clearly a regulatory need, and there's an obligation. This isn't an option to look after the mental health of our workers. It's actually an obligation. But I think if we treat it as a sort of a compliance exercise, we miss the opportunity, the richer opportunity for human interaction. And we miss that opportunity to, I guess, connect with people on the head and the heart. And I guess what I mean by that is that sort of balance of how we actually make decisions and how we connect with people. And certainly we need a pragmatic, business framework to make decisions, but we also need to use our heart when we're thinking about how we're treating people. And so I think there's great opportunity for engagement, for attracting great people to our organisations and retaining great people. I think it drives productivity and business performance when people are healthy and working well. And so I think there are, without a doubt, direct benefits. I would add another part to that, and that is that often, and Jill's presentation was clear at the start there, around a mental health continuum. And often in workplaces, we think about mental health and we immediately jump to mental ill health and the need to support people. And that is critical. I do not in any way want to undermine that need. But I think, this is a conversation for everyone in every workplace, not for the 1 in 6 or the 1 in 5 or the 1 in 4, whichever metrics we might be using, for everyone. And that is because we're all going up and down that continuum. And if we can absolutely support people, fine. But let's think about what we can do from a prevention perspective. And importantly, promoting the value of good work so that we can kind of get ahead of the curve. And for those people in an organisation that think it's over there, it's for that person or those individuals managing a mental health condition, we bring them into the conversation and say, no, it's about how do we keep our healthy people healthy? And that when people do fall and have some tough times, whether it be right now because of these COVID restrictions that we're facing nationally and particularly in Victoria, how do we ensure that people know they can reach out for professional help, whether that be psychologists, clinicians, EAPs, confidential support lines, their managers, their peers, talk about the issues and actually return to good health rather than keep it hidden and potentially have broader impacts where they need greater support later on. So long answer to a short question, Stuart, but it's pivotal to workplace.
Absolutely. I think you've touched on two very important points there, Mark, with the continuum of mental health as well as the importance of prevention. Now, Jill, I'm interested in your thoughts on this one. Why do you think mental health and wellbeing is important to focus on in a workplace?
Look, I think I really touched on this in my presentation, that certainly we still see that there's that stigma. We still see that this is causing a real big problem in New South Wales with those stats that I shared around the psychological claims. And certainly, as I mentioned before, I echo very much what Mark was saying, that there's still a lot of underreporting in this space. And I think if we can raise that awareness and education, the workplace, as I mentioned, we spend a third of our life at work. So the workplace can be a really great place to have those social connections and to enable people to thrive. So, yes, absolutely essential that the workplace addresses this. I think I'm not sure if anyone's seen the survey that just came out recently by SANE, where the findings were quite staggering, with 78.1% of people had experienced stigma and discrimination in the past 12 months, of which 43% of participants said that employment was one of their top 3 affected domains. So we know that stigma still exists, and we know that, if people start talking about it, they start leading change in the workplace, they start embracing and embedding mental wellbeing into their practices and policies, that we would hope to see a difference in this space.
Right, yeah, of course, that stigma is always a very important thing that needs to be addressed at workplaces. All right, well, we might dive a little bit deeper into the actual topic of today's webinar in terms of the question and answer part of this webinar. So, Mark, I'd like to get your thoughts on what the link is between workplace culture and mental health and wellbeing.
Again, a direct link to business performance. But I think that I spoke earlier, before the webinar started, around this sort of concept of care and compassion, using our head and our heart, and I think that a workplace culture that acknowledges the importance of good work, a workplace culture that is positive and leverages people's strengths, is really core. And I think that often we try and figure out how to implement policies and drive activity. And they are important, but so much of it gets to that just idea of human compassion and care and understanding and putting ourselves in other people's shoes when we're having conversations at work. And that is only really possible when we have a positive and safe culture. And if we don't have that, then what we do is, as sort of Jill mentioned earlier, people not coming forward, perhaps reporting, whatever it is, but people not reaching out for assistance. When absolutely we understand that workplaces are part of a contributing life. Most of us go to work to feel valued and to contribute and to have those social connections. And I think that if we can create that environment where it is and people feel safe to reach out and discuss what's going on in their life, whether that be work or non-work related, I think we create a really important culture of safety, that affects physical, mental, our well-being more generally, and that I think can only be a good thing. So I think culture is fundamental, and it's a tricky and almost nebulous concept sometimes. But if we think about it as that environment where it is safe to talk about these issues, I think we're a step ahead.
Yeah, I really like that phrase you used there, Mark, a culture of safety. That I think is a very important thing for a workplace to develop.
Yeah, look, and I think it's also, I guess, what I think is important is that it's important to recognise that workplaces can be the stressor. We go up and down in workload, and there's no doubt that workplaces can be the point of stress. But I think it's also good to flip the script sometimes and understand that actually for some people, I won't swear, but the tough stuff is happening outside of work, and they actually come to work because of the enjoyment and fulfillment they get from it, from the connection with their colleagues. And so we do need to take this understanding that it's not always about, adapting to the stress of work. It's actually understanding that work can be a great place for people's mental health, to both help them recover, but actually just to support their mental health more generally and keep them well.
Of course. And thank you for not swearing there, Mark. I do appreciate that. Now, Jill, I'm going to get some of your thoughts on this one. So the link between workplace culture and mental health and wellbeing. Do you have anything to add on to what Mark's just shared with us?
Oh, look, not really, Stu, but certainly they're interdependent, aren't they? If you've got leaders that are talking the talk and walking the walk, they're able to really share their own personal experience if they feel fit to do so. But for people to be able to feel like they're included, that we embrace diversity in the workplace, that it's okay not to be okay. Certainly, I think that goes a long way to making sure that that the culture in the workplace really is driving that message. Part of our strategy talks to that lead change as one of our pillars, and that's where we're encouraging leaders to ensure that they are looking at the risks, that they have things in place that support those risks, and that they have a culture that is able to effectively manage that, and people feel they can bring their whole selves to work.
Great. Well, that does bring us to the first interactive part of this webinar. So as long as I can get the technology right, I'm going to start the first poll for today. So the question will be, what are the organisational benefits of having a strong mental health culture? All right, so we can see here that the most popular answer was a safe environment to seek early help. So that probably does touch a little bit on what you spoke about earlier, Mark, in terms of having a culture of safety. All right, so I'd like to hear from our panel now in terms of what are the organisational benefits of having a strong mental health culture? I might get you to start with this one, Jill.
Sure. So I guess there's a lot of things. A workplace which attracts and retains people with lived experience, for example, makes good business sense as well. I guess that supports their purpose and inclusion for people with mental ill health, and in turn supports a successful recovery at work. So that's one of the benefits. Workplaces can also like I said previously, we spend a third of our life at work. So the workplace can be a really great place for mental health through our social connections and feeling of purpose. And then we spoke about that bottom line aspect, that it's good for your business. But I guess in terms of the slide that I addressed, where we're looking at productivity, we're looking at productive teams, we're looking at retention of staff, people feel like they are recognised within their organisation. And I guess I touched on some of those things around what constitutes a mentally healthy workplace, and embedding those core things into your organisation is key, isn't it? You know, when you have rewards and recognition in place and people feel valued, when you have flexibility in the workplace, that people have opportunity to work flexibly. Those are all things that support our work-life balance. So there's certainly a lot of organisational benefits to this. And people are able to thrive at work too. And as a result, you have staff that are engaged and want to be at work.
Great, thanks, Jill. And Mark, would you like to add any additional points onto this question about organisational benefits?
Oh, look, I think Jill and the responses have really hit them on the head around productivity and business performance, and the attraction and retention of great people. I guess I'd just sort of add that I think it's so, to me, indicative of an organisation that has great trust and respect if you do have people that are reaching out early for help. As someone that has managed a mental health condition, historically, and still do, I think that it is very hard to take that mask off sometimes. And if you can, and you feel safe, and you trust your colleagues and respect your colleagues enough to have that discussion, it says so much about the connectedness of that organisation, and I think that then speaks to the direct links to the work benefits as well, the way teams work together, the way you can provide and constructive feedback to each other. It's just a more open, strong, and I guess trusted environment in which to make better business decisions, along with keeping people well.
Yeah, I completely agree, and it is so nice to be able to trust your fellow colleagues, isn't it? It's a really nice feeling. All right, well, that means we're on to our second poll for today. So the next question brings it down to a bit of an individual level, if I can hopefully work out the polling system here. So the question will be, what are the individual benefits of having a strong mental health culture? So I'm just launching the poll now. So we can see that two are very popular there, so feeling valued and recognised for your contributions, as well as peer support opportunities and looking after each other. Not to discount the other two, though, of course. But Mark, I might get you to talk to this one a bit. What are the individual benefits from your experience of having a strong mental health culture?
Well, I think it's really interesting to see those results in this idea of feeling valued and recognised for your contribution, because often we think, well, what are we doing in the workplace to encourage a positive culture? And so much of that has to do with leveraging and understanding people's individual strengths and what they bring to a particular program or project, or just their role in general. And then recognising their performance, and that doesn't mean always just dealing with the recognition of the above and beyond stuff that people might go to, and that has been quite incredible to watch organisations and peers of my own here at SuperFriend go above and beyond in challenging times. But actually, it's as much as anything about just recognising the good job that people are doing every day, and those small things that leaders, managers, colleagues can do to really show that people feel valued, and I think that it remains clear. I've just missed it's gone off screen, but the bottom one was second, and which was that, Stuart?
see if I can share it again. But the bottom one was peer support opportunities and looking after each other.
Yeah, and just to touch on this one, what I think is really key here is people seeing value in looking after each other and looking out for each other. And in that video, you know, people, one of the case studies was around people seeing that you've got each other's backs and caring for each other. This, I think, speaks to a really important idea around shared responsibility of mental health in workplaces. There is no doubt, I think that leaders play a really important role, and we need the governance, we need the policies, the processes, and we need to build capability. But also we have an individual responsibility as well, you know, to understand what our own triggers and signs and symptoms are and how we manage our own mental health and whether we play that guitar or go for a run or whatever the case is. And this idea that, we're pointing fingers everywhere. I think there's actually shared responsibility and an innate want, as this survey has just indicated, to actually support ourselves and others in this process. So I think that was very encouraging, that result.
Yeah, I completely agree with you, Mark. And look, I would love to ask you to play the guitar for us in the audience, but I actually have I guess that's a sperm no from you, but I've got a more pressing question for you. So I know that SuperFriend has recently released something called the Top 11 Ways to Improve Worker Wellbeing based off some recent research that you've done. Look, with that in mind, what would you suggest are some of the key areas that a workplace should focus on to have a strong mental health culture?
Yeah, look, I just to clarify there, I think those 11 ways to improve worker wellbeing are part of a recently released Indicators for Thriving Workplace report, and people will gain that link after this this webinar. But that was released last week, and essentially it provides some really great insights into mental health and wellbeing workplaces Australia-wide. I haven't got time to go into all the details, but some really phenomenal and insightful and helpful statistics, findings, and tips through that report. When we think about what we can do, though, and what the research, the data from that report shows, and many other reports, we do need to think about ideas, and the ITW report talks about connectedness, it talks about capability, it talks about culture, it talks about policy, it talks about leadership. But I think, if we break that down to what can we do, building capability is really important. That sort of training piece, that not just about awareness, but giving people the skills to have the conversations and understand the signs and symptoms, and building that capacity and capability that gives people the confidence to talk about health and wellbeing in the workplace. It's a big part of how we can move forward. There's so much, and I could go further, but I'd be thinking strongly around that idea of building capability, but also this idea of ensuring that we're listening to our people. Jill mentioned it earlier, and ensuring that the voice of not just lived experience, but the voice of our people come into the types of things they need to help them manage themselves and their peers in the workplace. And also, I'd say activities that encourage connectedness, and we know how important that is, that people feel connected to their colleagues at work, and so there are obvious things like the brown bags we might do at lunches, lunch and learns, bringing a speaker into the organisation. Don't underestimate the value of action. And the cumulative value of that then normalises the conversation over time and builds that confidence. So, there's a lot, but I'd say, those areas in particular, and particularly trying to drive through building your capability within your organisation. And boy, as Jill's presentation noted, some great resources already through Black Dog, through New South Wales workplaces that are available, organisations like Beyond Blue, SuperFriend. There are so many resources from both a free and fee-for-service position that organisations can access to help build that capability.
Great, thanks very much, Mark. Well, we're very fast running out of time here, unfortunately. So what we might do is I might get both of you just to give us a key takeaway message, or maybe a key first tangible step to building a strong mental health culture in a workplace. Would you like to start us off, Jill?
Sure. Design work to minimise harm. Definitely promote and facilitate early help seeking and support recovery and return to work are some of the key things. I think prevention is key. If we get the training out there, if we build that capability, we start talking about mental health in the workplace and embedding this, we'll go far to address and create mentally healthy workplaces in New South Wales. And I'd just like to thank Mark as well for his insights on this webinar today and for the invitation to be part of this great conversation.
Thanks, Jill.
And yeah, your final takeaway message, Mark?
Yeah, look, start simple. I think and start, do something. I think there's a general view that, we've got to get our plans and our processes and our strategies in place, and we do, right? Absolutely. I'm not saying don't have, an integrated strategy. But if that is at the expense of just actually, starting a conversation or awareness sessions or some training and all the rest of it, then I think what we try and do sometimes is boil the ocean and do nothing. And then hope that one day we have this great strategy and plan, press the button and mental health is fixed. And I just don't believe that's the way it works in reality. I think, this just start actions, adapt, see what's working, what's not, and then move in parallel with your broader strategy and plans and build. And from there, I think you've got a great place of embedding workplace mental health and wellbeing into the way you run your business. And in the end, that's what we're after. We don't need this distinction between physical and mental health. Health and wellbeing in the way we run our businesses can drive business performance. And I think that's a great thing. And that's where I'll leave it. And other than to say to Jill, thank you very much, to Stuart, thank you for the invite, and indeed for everyone spending their lunchtime. We really appreciate it, and I hope there's been some insights for you in this. And please click on some of the links in this area.
Absolutely, I echo that. Thanks.
Excellent. And look, I just love that message of start simple. Well, look, thank you so much, Jill and Mark, as well as our support crew behind the scenes. We've got Megan, Nasan and Greg also assisting us today. That does bring us to the end of today's webinar. We do have a second webinar coming up in about 6 weeks' time. The date hasn't been locked in yet, but we are planning to discuss quitting smoking within a workplace context, which I'm very much looking forward to, and further information will be available very soon. Look, until then, thank you very much from the Get Healthy at Work team. And if anyone has any interest in finding out more about the Get Healthy at Work program, please visit our website, www.gethealthyatwork.com.au. Thank you very much.
Thank you.